The technology we are developing is applicable both to children and adults. In children, there are different challenges compared with those that are met in adults.
The problem that we have in order to monitor the sleep patterns of patients in hospital is the environment, which is very uncomfortable and unknown for the kids.
When the child comes into the sleep unit, they are met by a physiologist who is an expert in interpreting sleep studies, and they have sensors applied to their body so that we can monitor the physiological changes that we want to look at. The most complex type of sleep study is called a polysomnography, and that involves 27 sensors being attached to the child's body. So that would include a sensor on the toe, some sensors to look at leg movements, some to look at breathing patterns and oxygen levels, and we look at cardiac monitoring, and we look at the electrical signals from the brain so that we can identify the stage of sleep that the child is in. So this involves, although it's not painful, it involves lots of things being stuck to the body and can be uncomfortable and distressing for the child. And it takes around an hour to put all of those sensors on.
The difficulties we've had with sleep studies, we did have an issue where the fire alarm went off in the middle of the night in the hospital, and lights were coming on, and it did seem to sort of ruin the study really, or the results.
You can't really move as freely in your sleep because of the sensors like going down your back. It'd just be better at home because it's more in your own environment. You have a better sleep because you're in your own bed. And
we're collaborating with the Automatic Control and Systems Engineering Department at the University of Sheffield to develop a way of studying children's sleep using a method that does not involve sticking all of the sensors to the child's body, and so that we can study the child in their own familiar environment at home.
So we have developed a framework to automatically detect sleep disordered breathing events using nocturnal pulse oximetry. Sleep apnea events are deposits in breathing during sleep, while the hypopneas are overly shallow breathing during sleep. The sleep apnea-hypopnea syndrome is the main cause of daytime sleepiness and neurocognitive impairment, and it is considered to be related to cardiovascular disease as well. So it is very important to diagnose the syndrome as early as possible. Nocturnal pulse oximetry is only a small device placed on finger, so it is non-invasive and quite convenient for home monitoring. So that will enable the children to be monitored at their sleep at home instead of going to a strange environment with a lot of invasive sensors placed on their originals or around their heads. So that will relieve the pressure caused by the strange environments to the children, and it will make it really easy to check the progress of the treatment.
Our work hopes to actually conduct follow-up sleep recordings to be able to understand how sleep changes with time and how that might be associated with developing Parkinson's disease. In addition to this, our actual work can be used to evaluate future potential preventive medication. This is where wearable devices in coordination with Internet of the Things can provide a direct link between sleep clinicians and their patients.
The project is a fantastic opportunity for us to lay the foundations towards hospitals of the future. So the technology that we are introducing can release hospitals from the increasing demands and increase different levels of autonomy.
So having this technology at home make them more comfortable, and it provides more higher quality data in order for the clinicians to analyze, because the patient can sleep. Sometimes they cannot sleep in an unknown environment, but they are more comfortable at home.
This will help us to save admissions to hospital, and then thereby saving money for the NHS, and also save the staff time that is involved in setting up the sleep studies and analysing the sleep studies manually. We're hoping that an automated way of analysing the sleep studies will also save time and costs for the NHS.
This technology can bring us a lot of benefits, especially during COVID-19, because it can be used at home. So diagnosis and prognosis and monitoring the health can be done at patient's home environment.
Thanks to the Pitching project, we are bringing together different perspectives, the one of the patient, the medical person, and machine learning and AI.